Hi, I'm Dr. Alan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and tri-state community. I have a wonderful guest and a wonderful, wonderful topic today. Today we're going to talk about your thumb. Usually we talk about brains, we talk about spines, hearts, your thumb. If you say to yourself, is that so important? It really is. It really, really is. And so importantly that your brain, we'll go back to what I do as a neurologist, actually has a large part of the brain is dedicated to your hand and even specifically your thumb. Not so much to your shoulder, not so much to your thigh, but your hands are so important to you. So even whoever made up our brain knows how to put everything together. So I have one of the preeminent hand surgeons on Staten Island, someone who works at Richmond University Medical Center with me, Dr. Jayaram. He's been out here for many years in practice, doing a wonderful job. And we're going to talk about two things today. We're going to talk about your thumb and what could be wrong with it. And Dr. Jayaram assured me that so many people who are watching here today have pain in their thumbs. I said, really, thumbs? A whole talk about this? He said, you won't believe how many people have problems with their thumb. And when they hear that we're talking about their thumb, they're going to say, finally, somebody has listened to us. Second topic we're going to talk about is carpal tunnel syndrome, which is something that I see in my practice as a neurologist. Nerve compression at the wrist, at the hand, or a little bit above the wrist, and how we've come now to minimally invasive procedures to treat carpal tunnel syndrome. So hopefully Dr. Jayaram will make you feel comfortable in not being afraid if you do need the surgery, because so many of us do. So many of us do overuse with our hands. So with that, I'm going to say, Dr. Jayaram, thank you so much for joining us at Conversations in Medicine. And tell us about the thumb.
Dr. Perel, thumb is such an important part of the hand, important part of the human body. It is the thumb that distinguishes us from the apes, separates us from the apes. It is the thumb that makes us more creative and be able to perform so many activities, including the arts, music. All these things are possible because we evolved to have a thumb, which is such a versatile digit in the human body that we are able to do so many things with the thumb.
So tell us, so when people have thumbs, and obviously we talked about the importance, it doesn't take much to hold a pen, to hold a fork, to play the piano, play the guitar, all those things. But let's talk about the problems. Physicians always look at, and it's in a sad way, we sometimes less preventative issues, and we'll talk about things to prevent issues with your thumb and your hand as a whole. But also, what do you do if your thumb hurts? And when do you have to seek medical attention if you're having pain in your thumb?
If you have pain in the thumb for more than a month, I think you should see a doctor because you may need an X-ray after a good evaluation to find out what is causing the pain. The pain in the thumb can be due to several reasons. One, it could be from injuries. Injury would include ligament injuries to the thumb. Number two, any bruises to the thumb. And injury to the nerve from bruises can produce persisting pain for a long period of time till the nerves recover. It could be a fracture from injuries, or it could be arthritis. And arthritis can be two types of arthritis. One is osteoarthritis, which is more common, and the thumb is prone for more osteoarthritis in human beings because we use our thumb for so many activities. We are using the thumb every day for including brushing your teeth first thing in the morning, and then you make your coffee, you have to hold the coffee kettle, and you're putting a lot of strain. The weight of the coffee kettle produces pressure on the joints of the thumb, and over a period of time it will wear out, and cartilage will wear out and cause arthritis, and bone will start rubbing on bone and cause the pain. Or it could be from inflammatory conditions like rheumatoid arthritis, gout, lupus, and other conditions can also produce pain in the thumb. So a good evaluation is necessary, which would to arrive at a diagnosis, including X-rays if necessary.
So with you said examination, of course, X-rays, And have advanced techniques come a long way in this field, things like MRIs?
Yes, especially following the injuries. Don't treat thumb injuries very trivially. I see this all the time in my practice. For example, it snows and people slip and fall on the snow, and the human instinct is when they fall, they reach out with their hands outstretched to protect their face and other parts of the body. So the hand reaches out to the contact area during a fall, and a lot of the pressure will fall on the thumb, and that pressure on the thumb can produce either a fracture or a tear in the ligament in the thumb, and that can produce significant damage to the ligament and cause pain. And if that is not treated properly, they can go on to develop arthritis and weakness of the thumb for life.
So how do we prevent, before we even get to the conditions that you said even more in depthly, how do we prevent problems with the hands and specifically the thumb? And there's a whole field of medicine called occupational medicine. Since so many of us work with our hands, obviously, whether it's a surgeon, whether it's some baseball player, piano person, someone who's in school teaching, we all use our hands so much. What could we do to make our station where we are, whether it's on a computer, more amenable so that our hands shouldn't hurt us?
So when you have pain when using the hand, that means you're straining the hand quite often, more than you should be doing that, or you're overworking. Do you need periods of rest? Should you take a short break of 5-10 minutes during the course of your work while typing or using the computer? That will probably help you a lot in the long run. And do you have diabetes? Is it well controlled or not? If you have diabetes, it can produce tendinitis and locking of the thumb and a painful thumb. So keeping blood sugar under good control will also decrease the chance of developing tendinitis in the thumb and trigger thumb, which will need further treatment if you do develop it. So by not overdoing things, you can decrease the chance of developing a painful thumb.
So I know you have some images of the hand and the thumb being part of the hand. Maybe you could show us a little bit about them and what we could see and what we could learn, because everybody likes to see a picture. I mean, we have a model here of someone's thumb and hand as a whole.
This is the thumb here, and I'm focusing on what's called the carpometacarpal joint, that is here, where the thumb joins the wrist here. That is here in this picture, right there. Remember, in the thumb, there is one less bone than the other fingers. The fingers contain, here the picture is cut off. There are, in this you can see all the bones of the finger. 1, 2, 3, 4 bones in each finger, 4 bones. Here it's cut off here. In the thumb, there's only 3 bones, 1, 2, and 3 bones there. Okay, and where it touches the wrist, there are called carpal bones. Those are pebble-like bones there, which will improve the dexterity of your wrist, movement and fine control of your wrist. And then is the radius and ulna, and there is a cup-like depression there where these things glide easily for you to be able to do bending, going back this way and twisting. All this movement comes from here. And in this picture, it depicts arthritis that has developed, pretty severe arthritis at the base of the thumb. It's called basal joint arthritis or carpometacarpal joint arthritis. These pebble-like bones are called the carpus, C-A-R-P-U-S, and then this is called the metacarpal bone. Where the bone touches this bone, there is arthritis. The cartilage is worn out, and also the joint is slipping away a little bit here. You can see the increased space there, and there are bone spurs here present. So this is a classic arthritis of carpometacarpal joint. It's a osteoarthritis type, not inflammatory type.
So that's usually with overuse or age, and we get some changes.
That is correct.
In
It
the
is
thumb
overuse. Now, the biomechanics of the thumb is such that when you put pressure on the thumb at the tip, If you put 1 pound pressure, the pressure at this level is magnified 4 to 5 times. So 1 pound pressure is equal to about 5 pounds pressure in this joint, or the carpometatarsal joint, that is this joint here. So that's why this takes the brunt of the abuse, and cartilage wears out and arthritis develops.
So back to 2 things. Beforehand, we said rest, not use your hand too much. If you do develop this, is it hopeless?
It is not hopeless. There are several things that you can do. You always start off with conservative management. Conservative management would involve rest, warm soaks, pain medication, like simplest pain medication like Tylenol, non-steroidal anti-inflammatory medications like Advil, Motrin, Aleve, and then you can go on to stronger pain medications if necessary, but I don't usually recommend giving opioids for this pain. When you reach such a stage like that, we have to start thinking about maybe surgery, which will prevent you from getting into the opioid area, which is not a good thing. Surgery has excellent results. Before that, you can give a cortisone injection. Cortisone injection gives you excellent relief lasting for probably 3 to 6 months at a time, and you can repeat the cortisone shots if necessary. But you can't go on giving cortisone shots because of the side effects of cortisone past 2-3 shots a year.
Is there anything nutritional that people could do? You know, you see about glucosamine, chondroitin, various supplements in order to help your joints as a whole. Is there anything specific that you've seen that's helped people with their hands?
Certainly. You should look at your diet first of all. If high sugar diet, too much caffeine, and some books mention about excess alcohol, all these things will aggravate the painful condition. So if you can control that, it will help. Some people are sensitive to vegetables like tomato and eggplant. It's called Solanaceae family, and the chemical in these vegetables is called solanin, SOLANIN, and in susceptible people, those who are sensitive to it, the pain can increase. Not everyone develops this increased pain when you eat these vegetables. So don't give up on this.
Don't give up tomatoes. This would be very, very
right. Don't do that. Only if you're proved that this particularly gets aggravated when you take it, then you should control that.
So those are the nutritional type of things.
Right. Next would be to take glucosamine chondroitin sulfate. May help you, but it helps in the bigger joints like the knee joint, and not many people take glucosamine chondroitin sulfate for the thumb joint. And the other thing is omega-3 fatty acids. They seem to help a little bit to improve the quality of the fluid which lubricates the joint, and the cartilage condition supposed to improve a little bit by taking the fish oil or flaxseed oil.
But when you do develop arthritis in one of your joints and one of your hand joints specifically, and even super specifically the thumb, it really never is cured, is it? It's treated, but we don't cure many things in medicine specifically, other than, say, taking out your appendix or having an infection. Sometimes we can cure it. But it's really a chronic condition.
Yes, medications are not a cure. They help you with tiding over the pain.
And when should someone go to see a hand surgeon when they have problems with pain in their thumb?
When the pain lasts more than a month and you've tried everything, taking Tylenol, resting, warm soaks, and if the pain persists or if the pain is increasing, then you should see a doctor.
And we talked about gout before. Some people think about gout as being in your big toe, but I wouldn't be surprised if it's in your thumb also.
Gout can affect most parts of the body. Big toe is the most common area, especially the big toe. And then it can affect the finger joints. It can affect the thumb also.
I always think it's interesting when I talk to patients, sometimes I'll use numbers instead of the common thumb, forefinger, ring finger, pinky. We always just use numbers, correct? 1, 2, 3, 4, 5, starting with the thumb, because it really is so important.
That is correct. But in the hand circles, in hand specialists,
Tell me.
they name the finger.
Really?
Because if one finger is missing, then what happens?
Oh, how interesting.
Suppose a person lost a finger due to amputation or an injury, then everything becomes confused there.
I never thought of that.
Yeah. So you name the finger. Start with the thumb, index, middle, and ring and little fingers.
Oh.
So 5 fingers. Or if there are 4 fingers, you name them, which fingers are present.
Okay, I've learned something very interesting. Yeah. So thumb's very important, helps us function, helps us live. Just maybe to touch base a little bit on the occupational medicine portion of it. I know you mentioned rest, but it's so important for people to have a proper station. If you have a chair that's too low, you're putting pressure on your wrist and even on your thumb joint. If your wrists are always up. There was a gentleman who came to me in my office today, and you know what his job was? He worked for the Department of Transportation on the streets, and he's the jackhammerer. And his hands were hurting him. And what do you say to someone? I'm sure you've had a lot of people who work for the city or work for private industry who do things like laborers or jackhammerers. How do people survive doing that kind of intense trauma to their hands?
It's a very good question you brought up. So work-related problems are very common. It's all overuse and other physical forces that pass through the hands. When you use a jackhammer, it's the vibration that has a unique damaging effect on the tissues in the hands, because most of the vibration force passes through the hands when you're holding it and doing it day in and day out every day, and it produces vibration injuries to the hands. So these people should be taking periods of rest, which is very important. That's the most important thing. And then can they go on like this for life? No, they can't. They will reach a stage where it becomes impossible to function because they can develop vibration-related injuries to the hands. They can develop carpal tunnel syndrome also in vibration-related activities like gripping a jackhammer, which is constantly jarring the hand and producing vibration injuries to the nerves.
Let's go into carpal tunnel a little bit with that segue that you mentioned. So I use the example as a neurologist. The carpal tunnel falls into a little bit of both of our categories. Someone comes in with some numbness in their fingertips. We have to see which nerve is involved. But the most common traumatic or entrapment neuropathy, where a nerve is being entrapped, is something called carpal tunnel syndrome. So if you could tell us a little bit where the carpal tunnel is and which fingers are most involved. And the good thing about carpal tunnel syndrome, many times it's a treatable process. So many things like arthritis and various other injuries that we have, we really can't treat them that easily other than symptomatically. Carpal tunnel syndrome is amenable many a time to different kinds of procedures and particularly surgery. So tell me a little bit about carpal tunnel syndrome from your point of view.
I think carpal tunnel syndrome should be treated with due respect. Patient may have other conditions contributing to the symptoms of carpal tunnel syndrome. It may look like carpal tunnel syndrome. It may be coming from other reasons. So I'll go with the description of the classic carpal tunnel syndrome and then move on to what other things can contribute to this and what we should look for before you do any surgical procedure. You should always follow the algorithm so that we don't make mistakes. So the carpal tunnel syndrome means there is pressure on the nerve. It's called the median nerve, M-E-D-I-A-N. Median means in the middle. The nerve passes through the middle of the wrist, and the nerve comes all the way from the roots of the nerve come all the way from the neck, passes down the inner aspect of the arm, then comes to the front of the arm, then enters the wrist, under the skin and under a ligament called the transverse carpal ligament. And in that space is called the carpal tunnel. And the other components of the carpal tunnel are, there are bones, like 4 pebble-like bones arranged in a cup like this. And then in front of the cup, there's a ligament there, that's the transverse carpal ligament. that will complete the tunnel there. So this is the tunnel. Here are the bones, 4 bones arranged in a row, and then the ligament bridging that. Actually, there are 8 bones there in 2 rows there, side by side, but majority of the carpal tunnel is formed by the first 4 bones and then the transverse carpal ligament. Inside that are 9 tendons there. So there are 5 fingers. You expect there to be 10 tendons. No, the thumb has only 1 tendon going there. So you have to deduct 1 tendon. So all the other fingers have 2 tendons. So 2, 2, 2, 2, 8, and this is 9. 9 tendons are jam-packed inside the carpal tunnel, which is in front of that row of bones and then under the ligament. And over a period of time, due to overuse, or it can be from diabetes, or it can be from other reasons, some inflammatory conditions like rheumatoid arthritis, swelling will develop and more pressure will develop inside the carpal tunnel. Given a normal carpal tunnel, there is just enough space there for everything to function normally, for the tendons to move and the nerve to function, carry the electricity to all the fingers. When the normal electricity is passing through and carrying the signals from the fingers onto the fingers, you don't feel numbness and tingling. But once there is pressure, the flow of electricity slows down. And then that's what causes the numbness and tingling in the fingers. More so during the middle of the night, when you're resting, when you're sleeping, when your arm is dependent and more fluid will accumulate inside the carpal tunnel in the night, and more pressure happens in the night time because of fluid accumulation. When you're moving the hand, the fluid is being pumped back into circulation. So during night time, because the pressure increases, it will wake you up from sleep and cause the numbness and tingling. And that is carpal tunnel syndrome.
So it's interesting because my explanation is always many people sleep like this. All of us sleep like this. And we put some pressure on that carpal tunnel.
Dr. Perel, your point is well taken. It's absolutely true. You look at anyone sleeping, you always curl up, including the wrists. This is called a neutral position of the wrist. And when you are neutral position, less pressure on the nerve, less pressure inside the carpal tunnel. When you curl in, more pressure inside the carpal tunnel and causes more symptoms. So you're absolutely right.
And it's interesting because I have a lot of families who have carpal tunnel. They've come to me for a lot of the electrophysiological, the electrical tests to confirm the diagnosis. And as you mentioned, there are things that look similar to carpal tunnel from a pinched nerve higher up that we can mistake it, and we don't want to do surgery unless we're sure. But the interesting, what I always say to patients is some people have bigger noses, some people have littler noses. Some families have bigger tunnels and never get carpal tunnel. Some people, 18-year-olds, come into my office, classic carpal tunnel. And you ask, their mom had it, their grandma had it, their sister has it, their brother, and it's not genetic. It's genetic, but it's not sex-based, men or women. And it's interesting that you do see families who have this type of syndrome.
That's a very good observation, Dr. Perel. That point is well taken. So it is highly variable. It's difficult to say who is going to develop this carpal tunnel syndrome, but you're right. Those who have with small wrists, they're more prone for carpal tunnel. That have seen. Women are more prone for carpal tunnel syndrome because their wrists are smaller, everything is more jam-packed or a smaller area. And those who use their hands a lot, repeated activities, people who are using the computer, typing, and who are in the packaging industry, they develop carpal tunnel syndrome because they're using hands all the time, and you have to do so many packages. Every hour you have to do a certain number of packages. You're given a quota there. It's really true.
There's an Amazon factory on Staten Island, so we do see that.
Those who are in the, for example, those who prepare in the meat industry, like chicken preparation, they are very prone for carpal tunnel syndrome.
So here's a question that comes to me every day. Somebody comes in and we check him out and we do the nerve testing because there's some numbness in the fingers. Does everyone with carpal tunnel syndrome need surgery?
Definitely not. You have to follow a certain algorithm in this. You have to stratify. Stratify means you have to find out at what stage these patients are. Is carpal tunnel syndrome mild, which can be treated with conservative measurements like you rest, splinting, B complex. Again, when you go to B complex, before I forget, don't take big doses of B complex. It is actually, sometimes it can be toxic, like B6. Don't exceed more than 100 milligrams. It can be toxic to the nerve actually. So please don't exceed more than 100 milligrams of B6. I still see patients coming with history of taking B6 for carpal tunnel syndrome. But be careful, take only the right amount that is necessary for your condition. The other thing is rest, splinting. Splinting means when you go get a splint in the pharmacy or wherever you get it, it is a generic splint that you usually get. And the mistake there is the splints are made to push your wrist back this way. There's more pressure on the nerve whether you hold your wrist back this way or this way. Like during night time, you sleep with the wrist curled in, and the splint pushes it back this way. That also produces more pressure in the carpal tunnel. So the splint has to be straightened out. You can customize it to yourself. There's a metal piece or a metal strut inside the splint, inside a pouch. You remove that, straighten it, put it inside, and wear that during night time, and that will give you more relief than using a brace holding your wrist this way. So correct use of brace is important.
And not too tight.
Not too tight.
Everybody
That is correct.
Everybody feels too tight.
And get the correct size.
We're going to jump onto the surgery now, because again, that's why I have you specifically here. So yes, electrically, I can tell if someone has mild, moderate, severe. Sometimes people with milder carpal tunnel, nothing works, and you do have to do the surgery. So a lot of it has to do with the patient. So the question comes to us is, what kind of surgeries are available in 2026 compared to the past? What choices do people have if they do need surgery?
In the past, the classic operation was the open surgery, open release of carpal tunnel syndrome, carpal tunnel, by making an incision starting from the proximal palmar crease. If you look at your own palm, there are two creases going horizontally this way. So you start just proximal or towards the wrist here, and and you draw a line from the ring finger to the wrist, middle of the wrist. That's the direction of the median nerve. And you make an incision starting from there, and then come all the way down to the wrist crease. But don't cross the wrist crease, because once you cross the wrist crease, there will be a lot of pain after the surgery because of the movement occurs at that wrist crease. So you should avoid the scar at the site where the wrist moves. So we stop short there. And then we spread the skin apart. There's a membrane there. We cut the membrane. Then you see the ligament there, the thick. You can actually see very thick ligament there, and you make a cut in the thick ligament, and you've got to be careful. There's a blood vessel there. You have to protect the blood vessel so you don't damage the blood flow to the fingers. Then you start cutting the ligament from there to here, all the way there, and you should guarantee a complete release. That's very important, guaranteeing a complete release. Even if you leave a small strand of the ligament behind, it will still cause pressure, and the same symptoms will remain.
So I'll tell you honestly, we have 10 seconds left. Now we have minimally invasive procedures. People get better faster. You said within a week most times people get better or can go about doing their regular routines. So I want everyone, because we really are out of time, to think carpal tunnel surgery is something that's really 2026. Less invasive, just like other procedures, things that could really help you feel better. So again, if you have that diagnosis, don't stay home and don't say that there's nothing that could be done. I want to thank Dr. Jayaram for his wonderful talk about hands, thumbs, and carpal tunnel syndrome. And to everyone, keep your hands in good shape. Have a great night, everyone.